items to review from our previous webinar. Oh, I'm seeing that our meeting is being recorded, so everyone is aware of that. So we're going to go through items to review from our previous webinar, some things that I heard you ask questions about, wanted more clarification about, and I've tried to address. Then we're going to look at what copies over to the revised MnCHOICES application. And then we're going to look at the historical data from the two applications, current applications, the assessment and the support plan, and they're being saved in PDF format. So that's kind of our plan for today. So items from previous webinars, some things I heard you ask about, and then I wanted to make sure they go back and talk about again because we're seeing them come up in help desk form questions as well. So we're going to talk a little bit about MTZ and Train Link courses to help answer those questions about which courses your staff should take. We're going to talk a little bit about historical data later. We're going to talk about assessment transfers and where that sits. We're going to talk about MCOs and the MICP list. We're going to talk about Help Center documents, which include the current functionality and future enhancements document. We're going to talk a little bit about what blank documents are going to be available and their usage, and user access on the day of launch, because you've had questions around that. And changing context is another place I've heard people have questions. So I want to make sure I address these items first. So let's just talk a little bit. Let's start back on training. We mentioned at our last webinar that the purpose of MTZ is really to give your staff a chance to learn the basic structure and practice using the system. MTZ was created before PROD. You've heard me say that before. So it's an older version of the revised MnCHOICES application, and it doesn't currently emulate PROD. So you will see notifications may not be working as PROD has. Oh, I see co-host with their hand up. Do I need to stop a minute? A green hand?
No, you don't.
Okay, cool. And then services, we in MTZ, when you do your exercises around services, we're giving you very specific services to practice with because the services may not be the most updated. And so we just want you to be aware of that. And we are auditing roles currently just to make sure that they function the way that they're expected to, but we anticipate that there may need to be some changes in MTZ. So we just wanted you to be aware of that. FEI Systems is releasing, is on a release schedule, and they are releasing changes to production and to MTZ, but we do have some past data that may need some cleanup. So we just don't want you to be surprised by it. So I heard you loud and clear last month that, hey, we would just like some tables to help us know what people are supposed to take and when they're supposed to take it. And so this is my attempt at it. Please know there are several slides to this. It's not one big table. And the reason why it's not one big table is really about accessibility. Tables aren't very accessible for people who have any vision needs. And so as far as needing to make screens bigger and other things. And so this is my attempt to keep a table accessible as well as to give you the information that you need. So let's talk through a little bit about certified assessors and what they need to take, assuming that, that here are the two instances for those folks. If someone is an existing assessor, they've been certified in the MnCHOICES assessment application, that's what M&A stands for, so the current MnCHOICES assessment application, and that's where they completed their certification. For them to take training for the revised MnCHOICES application and not affect their certification courses, they would take the courses that are listed in the screen, the Access and Navigation course, the Content course, and the Workflow course. Note that the Content and Workflow courses end in A because that way it's outside of their certification coursework and it won't affect it. Then next, for assessor certification, where an assessor, a care coordinator has completed their certified assessor certification in the new revised MnCHOICES application. So then our thought is that the person isn't using any systems until after launch, okay? And so if they're only using the systems after launch, then they can go ahead and take these courses again. Because they've already been certified and we don't want to affect their certification, they can take the ones that end in A again, and access and navigation in 900. I know that was one of the questions that you had. How do they not affect their certification courses that they've completed? And this is how they can do it. So what about the folks that need yet to be certified? So if you have an assessor who needs to be certified in the current application MNA, MnCHOICES assessment prior to launch, then you're going to follow the MnCAT instructions, okay, to be certified in the old system. And then what will happen is they'll need to take their courses for the revised MnCHOICES application as shown on this screen. So they'll need to take them. So they actually have those courses, but it isn't built into recertification. So they'll need to take a course that ends in A. For someone who's not certified yet and isn't going to be working in the MnCHOICES assessment, the current application, then they would just go ahead and take their certification courses in the revised MnCHOICES instructions. Okay, they can do that, and then that will get them everything that they need. And MnCAT 3 includes access and navigation, content, and workflow for the revised MnCHOICES application. You have been asking me questions about what do care coordinators take, what do case managers take, what do case aides take, what do supervisors take, and that's where we're going with these next slides. So for care coordinators who are not certified assessors or are certified assessors and need to take courses related to the HRA, then what you see here are the courses that they would need to make sure they take, okay? So for the content courses, they need to take the HRA and the support plan content, and workflow, the HRA and support plan content. For case managers, they need to take access and navigation so they understand how to use the system, and they would make sure that they have taken prior to launch the content and the workflow courses. Okay, I thought I had ones in here for case aides too. Oh, I know why. Sorry. The reason for this slide is I also heard folks' questions loud and clear about what do we do with EWRS rate tool, right? How do we train on using it in our training on support plan? And so I thought it would be useful to call that out, and then also know that we called it out. We revised the support plan workflow training for when you practice the EWRS rate tool, that it calls it out to use this practice guide. So let me just talk this slide through. If you are doing an elderly waiver residential services rate, so when you click get rate, it brings you to the rate tool. How do you know where to take your training? So again, there is a module, a content module on the EWRS rate module, it's called, in that MnCH 9020. In the My Supports module, in the workflow courses on the support plan, you'll practice entering a rate that will take you to the EWRS tool. And then what we are telling you to do is to go into the Help Center, find the practice guide that's the support plan form, and use the EWRS rate tool field guide, okay? This field guide will walk you through anything that you would want to know specifically about the tool. So just so you're aware, that is our training instructions for that. And like I said, in this My Support Plan module, we just are updating it to refer people to using this field guide to assist their work. So now let's talk a little bit about rate and support staff. So rate staff, again, what will be important for them to know is how to access and navigate the system, how to, they'll need to learn a little bit about the My Supports module. In the content modules, they really don't need to take the others, but understanding that module would be useful, and then understanding the workflow for the support plan will also be useful to them. So they have a context of when they're coming in the process. And for support staff, what I recommend is they take any of the courses for the staff they're going to support. So they have a better understanding of what they're looking at for content and what they need to know for workflow. So if I'm support staff for a case manager, I will probably want to take the same courses a case manager takes, as an example. So what about supervisors? What should you be taking? So I'm recommending access and navigation coursework because you need to know how to use this system. And then I think the same thing holds true for you as did for case aides. You'll need to take the content and workflow modules that apply to the staff that you support and supervise. And then we also have a course called Overseeing MnCHOICES, and that course has a couple of courses in it, and we will be adding others to it that help you understand how to oversee the work of your agency. You will also have people with the lead agency security admin role in your agency, and they will need to also learn how to do the access and navigation. They don't really need to take the content and workflow modules because they have limited abilities on what they can do in the application, but taking the Overseeing MnCHOICES course will be useful to them as when it gets closer to launch. Having them take that course closer to launch as they think about adding users will be useful to them. So this is a new slide. It won't show up in the PDF when it gets posted, but I'm going to see if I can get this slide added. I've been seeing questions as you're handing out your usernames to folks about what to do, either because you need additional MTZ users or you need to update user roles. You need to add a user role or remove a user role. At our last webinar, I talked a little bit about that we were adding a smart guide. I actually posted it to the Help Center for MTZ yesterday. So just to give folks a little context, for lead agency supervisors, if you take the Overseeing MnCHOICES course, we've added a course called MTZ, Adding Users and Managing Roles, and it supplements or is complementary to the Smart Guide MTZ, Adding Users and Managing Roles. And that can be found in the MnCHOICES Help Center. If you put in Smart Guide, you'll see the list of them and you'll see specifically the one that starts with, that follows the same. This is what its heading looks like, MTZ, Adding Users and Managing Roles. And it talks about how to manage a user's role, what things you might want to consider changing if you change a user's role, just to make those usernames more useful to you as you prepare for training, and to make sure your user names have the roles that they need so that you can train appropriately and manage those usernames appropriately. The other two items I wanted to make sure we talked about today is we've often talked about in webinars that you are welcome to send in your feedback on the Revised MnCHOICES application. We have so many calls, I think it can be kind of confusing on which calls we're having and where content is appropriate and whatnot. And so I just wanted to make sure that you knew that we welcome your feedback. We would really like you to use the MnCHOICES help desk form to provide us any feedback, and that we are collecting and reviewing that information. So I wanted you aware of that. And then I also wanted you aware of the topics for the webinar schedule. I just changed the county link, the Revised MnCHOICES application page to include this schedule, and so I wanted you to be aware of this. So in January, we're going to talk about the transition timeline and expectations. We will have our transition instructions updated. I see February as an opportunity to just dive in and ask all the training questions that you have or want or could have with your or that your staff are bringing up. And then on March the 8th, it's my plan to reach out to your security liaisons and gives them some time to talk about adding users in the system so they get comfortable with it. So it would be useful for them to have their security, their training, that I showed in the slides prior to that meeting, but we will work to put something out to them in that effect, and we can include mentors so that you're aware that the email went out. And then I see the April meeting, since it will happen after our launch date of April the 3rd through July, those webinars really being about post-launch support, answering your questions as you're using the application, the production side of the application. So that's kind of our plan for training to date. I am also looking at should we have another training opportunity in January so that we can ensure if that webinar gets used for all transition conversation that you'll have a chance to ask some questions. So I'm thinking about possible another training opportunity. And so let me see. Yep, I think that puts us to our questions. And what I was thinking about before we get any farther, I'm just going to back up to this slide. So knowing this training schedule, I'm curious about if you would like to have an additional session in January to provide you an opportunity to ask training questions and maybe go through the current functionality document in a little more depth. And what I would ask you to do, and I know folks, I haven't said this ahead of time, if we can see them on the tiles, if you can put a thumbs up for your reaction, and we can get a sense of that as you're voting on yes, you do have an interest in that, that would be useful in our decision making on our part. So I'm thinking a January time where you could ask training questions and we could walk through the current functionality document in a little more detail. If you're interested in that, yep, just do some thumbs up so that the folks on our side can see them. We can get a sense of how many people might be interested in that. I'm seeing some thumbs on my screen, so that's good. And we will take that as our kind of voting indication as we move forward. So before we get any farther, I just want to make sure that I allow you to ask questions specifically about this training schedule and kind of what I just walked through for content to make sure you don't have any questions. I don't want to get so deep and then have you have to be like, wait, go back there. So if you have a question that was related to these training slides, if you could raise your hand, I will have one of the DHS SMEs call on you, and then we will work to answer your question. Are there any questions?
So Teresa, it looks like we have a question from Jody Kugel-Lindstrom. Jody, I'll unmute you. Hi, Jody.
Hi, Jody. Good morning. You are off mute and should be able to just go ahead and talk.
Well, maybe, Jody, I am gonna, oh, no, she's back on mute, so she must maybe have taken her hand down. Okay, so Kathy McMahon, I'm gonna unmute you. There you go. Hi, Kathy.
Hello, can you hear me? I think so. I'm wondering if there's any way that is in order for our office support to get the assessment assignments into the tool in advance, like of the users, because we don't want to lose like a day plus for office support to get assignments in, and we have particular ways of doing assignments. I'm aware that assessors could potentially add their own assignments, but that's not a business practice that we're used to and not sure how that would meet our needs. But so anyway, we see an assessment assignment issue. And then the other question I have is for any training session in January or whatever else, would the DHS be prepared to have a list of all the workarounds, things that are not apparent in the tool, but that will require because maybe a drop down doesn't have all the options or whatever the item is that's not quite fully automated yet. Could there be like a master list of workarounds, and could you go through that? Thank you.
Yep. Yep. So Kathy, I'll try to answer your questions one at a time. So assignments in the system, I would really like you, if you could, put that in the help desk form, because what I hear you saying is you would like access to the system prior to launch to be able to basically put your intakes in the system and assign them out to staff so that you're ready to go day one. And so
Correct, because that
yep,
might even take a couple days. Like we have,
yep,
you know, it's a large operation here. Thank you.
yep. So if you'll put that in. And then secondly,
Will do.
regarding the other piece, so the current functionality and future enhancements document is to be that. And we're working to have all of the items that need to be discussed and worked through, ready and published by January 1. We're working diligently on it right now to get it ready to be published. That's our goal, is to have it available in the help center by then. And then it was my thought that we could potentially walk through those kind of like a mini MMA at a meeting in January.
Thank you very much. That would be awesome.
Yep, you're welcome.
Okay, Teresa, next we have Ruth Warrenhorst.
Hi, Ruth. You should be unmuted.
The MnCHOICES training to prepare for helping our nurses and social workers train as well. So it's a little frustrating for me, and maybe I'm just missing the obvious, but which training is specific to walking you through from beginning to end your work in the training zone? So you're doing the training and you're also going into the training zone from the beginning of entering a person all the way to the end to closing and doing the support plan.
Yep, so you're talking certified assessors specifically, right? So if they have, so let me go back one more. So access and navigation is the basic, how to use the system, how to create a person, okay?
Well, that
So no,
doesn't
I'm
have
just,
you like doing it in the,
no, I know, I'm going there, just,
gotcha.
and then workflow is where the exercises are for to create an assessment, do work in an assessment, and be able to close the assessment.
So 303A walks you from the beginning to the end of working
Mhm.
in the training zone.
Yep, correct. Workflows are about exactly that. That's kind of why we named them what we did. Content is really about how is the document, the form, what's its structure, what's in it, just that basic understanding of that form. And then workflow is about how to work through a form beginning to end.
Okay, thank you.
Okay.
I don't know how I missed that, but I
That's
just
okay.
couldn't find it anywhere.
Yeah, that's why we're trying to give them like headings that like hopefully will help people understand. So very good question. Thanks for asking it.
Okay, thank you.
Yeah, you're welcome.
Okay, Teresa, we have Kimberly Goosey, I believe is how you say your name. I'm gonna unmute you.
So I'm just a little confused. So I'm already a certified assessor. So are these 301A and 303A, are those for the new content? So I should be trying to do them now?
So the question in the past, and very good because it was on my radar, it pinged on me just as you were getting ready to come on, is the question we've been asked is, we already started training, right? How do we know what training to take now that we're, launching again, right? Starting this process again. So what my recommendation to you is, and I didn't put it on these slides because I just wanted to show you what's available, is everyone should probably retake the access and navigation so they can get their head around it. If they've taken the content modules, they don't have to take them again. They haven't changed. They should retake the workflow modules because they are being updated and they have seen significant enough updates. I think it makes sense for them to redo them. Does that answer your question? And then the other question that I saw in chat that I want to make sure I get to too is if you're already certified using the revised MnCHOICES application, no, you cannot use 301A or 303A for CLUs If you're a MCO certified assessor and this is your first certification, it's the same content you were certified on, so no, you can't use them for CLUs.
Okay.
Did that answer your question? Sorry, I popped in the other one in there too.
Nope, I think so. So I should go and take the 303A and 301A.
Yeah, for sure the 303A for workflow. If you haven't taken the content one, yeah, take it because, like I said, it kind of lays out how the form is organized, making sure you understand the kind of the whys behind some of the information. It will be useful if you haven't taken it yet.
Okay, thank you.
Yep.
Okay, Teresa, we have another phone or another call from Jamal Akabor. Jamal, you're unmuted.
Can you hear me?
Yes, I can. Perfectly.
Can you please repeat the CLUs again? I didn't hear that clearly.
Sure. So what we're hearing, or what I saw for a question, is there are some certified assessors that are care coordinators who just got certified, okay? They just got certified in the Revised MnCHOICES application because they're going to be doing their work in the Revised MnCHOICES application when they start. Part of their recertification courses already include the content and workflow. So yes, though they need to review them as part of their getting ready to launch, they don't get to be counted as CLUs because they were part of their certification process. Does that make sense?
So what about those certified assessors who are currently using the regular MnCHOICES assessment that we have?
Mm-hmm. So for you guys who are using the MnCHOICES assessment computer application, you could count them towards your CLUs. But the
Okay.
MCO care coordinators can't because they had to take, anybody who's taken the certification only in the new system can't count them because it was part of their certification process. But folks who are in the MnCHOICES assessment application can count them towards CLUs.
Thank you.
Yep, you're welcome. I see the question
Okay.
about the launch date, and I just want to make sure I say the launch date has not changed. It has remained April the 3rd. The system will be stood up March the 31st, and it will be live and ready for you to use April the 3rd, 2023.
Yeah, Teresa, there's still folks with their hands up, so grabbing those folks first, and then I'll come back to the chat. There's a few more questions that we'll need to get to there as well. But so the next question, person with their hand up is Lana Callan. Hi, Lana.
I am wondering, so I am a coordinator with a MCO, and I'm just wondering, and maybe this is upcoming, but just wondering if we have not done the certification for assessors, should we continue to do that in the meantime, or should we wait closer to launch to take the test for the certification?
I would recommend that you get it done.
Okay.
I just think that the more of that you can get done so you're ready to go, the better for you. If you've got time to do it now and fit it in when you can, I think that's just best for you.
And another quick one, just to clarify based on what you said earlier, if we have folks on our team that are not certified assessors, you recommend taking the 900 and the 303A course, again, as a refresher, correct?
Yeah, so here, I was just gonna go back to it. So if they're certified assessors, but they aren't gonna be doing, or sorry, if they're care coordinators and they're not gonna be doing assessments, is that correct?
Will be, I'm sorry.
They will be?
Correct.
Then you would have them first get their certification. And that is different than this. So they would be taking their certification here. And when they do that, they'll be taking all of the access and navigation content and workflow as part of MnGAT Step 3. It's built into it.
I see. Okay, thank you for
Okay?
clarifying.
Yep, you're welcome.
Okay, Teresa, Sarah Hickman, we have unmute you.
Hello. I think I might have figured this out, but I just want clarification on the support plan training.
Mhm.
For assessors, I'm just trying to remember, the support plan is, so some assessors will need to do a CSP, but that's in the assessment report. Is that correct?
It's in the assessment summary. So the
So
CSP has been
that,
built into it. Yep.
okay, so that's why assessors don't have to do the support plan training. And
You
that's
may
only
have
listed. Okay.
Right, you may have to do it if you're doing state plan services and you would normally do support planning as part of that.
Okay,
So you
so
you have to kind of think about what roles you have at that point. Am I a certified, you know how we've talked about hats before? Which hat are you wearing? In this
Yep.
case, if you're wearing a support planning hat, then you would need to take the support plan training as well.
Okay, so really the assessors in our, well, I think in most areas, if they just have assessment teams split from case manager teams, initial assessors should do the support plan training because they will most likely at some point in time just have state plan services.
Yeah, correct.
Yeah, so
If
could
that's,
you,
yes, go ahead.
I was just going to suggest that that might be helpful for you to add to the previous screen, under, you know, another column for support
Mhm.
plan for assessors, because that, if we use this and replicate this for our trainings,
Mhm.
for direction, it's not going to be there.
Okay, so what you're thinking is, I think what I might do is change this heading here. I may do case managers and certified assessors who complete state plan services.
Yep, that's fine too.
Would that work?
Yeah, sure.
Okay, so
Just
I'm
as
gonna
long as it's
do that.
somewhere on there.
Okay.
Okay, thank you.
Mm-hmm.
Okay, Teresa, we have another question from Giovanna.
Hello?
Hi, I can hear you.
Hi. So I have two situations that I wanted to clarify. So, and I think you kind of started talking about this. Care coordinators who don't do assessments, but they do HRAs, they don't have to be certified, meaning that the trainings that you have here in your columns are what, okay.
Yep.
And then the state plan services, just to clarify, for me, so our initial assessment group for elderly, we do initial assessments, CSP, and then we do rate plans, which we are currently able to do in the CSP, because many assisted livings actually want to know the rate before a person moves in. So I wonder, is the rate plan going to go only through the CSSP portion, or can we still do it only, you know, just a regular assessment and just somehow add the customized living service there?
So I will walk through all of that with you, okay? So for care coordinators who aren't completing assessments, and they would then take the health risk assessment course content and support planning course content, and they're laid out specifically for the health risk assessment that is listed here. If you have folks that are currently using rate tools in the support plan, those they will need to take the support plan content modules and they'll need to learn how to do them. Specifically, I would take all of the support plan workflow because they're going to be working and building a support plan. And the My Supports module in that workflow is specifically going to have them enter in a service that will take them to the Elderly Waiver Residential Services tool, and then they can use this practice guide. The EWRS rate tool field guide is inside of it to complete their work, to use that as kind of their guide as they're working through it and asking and answering questions for themselves. So EWRS rate tool becomes part of support planning. So if they have done an MnCHOICES assessment and now they're doing an elderly waiver residential services tool, it will be done in the support plan as an overall part of support planning. So I think I answered your question, and Smees, you are welcome to jump in if you would like to do that differently or better, or however, if you think I need assistance in language, I'd be welcome to it. But was that clear for you? Does that make sense? Okay.
Giovanna hopped off mute.
Okay.
It was very, I think it was clear, Giovanna. If you want some more explanation, just come on back or raise your hand again. I have Leah Fernell.
Hi, Leah. We are not hearing you, Leah. Just make sure that, there you go. I heard you for a moment. I just don't want you talking on
There
mute
you go.
too long. There you go.
Wouldn't it be true though for an MCO care coordinator would have to do a full assessment if the person is elderly waiver and not just an
Correct.
HRA, because that would create an
Correct.
age type doc. Okay.
Correct. Yep.
So
the
yeah, they're
piece to
not all going to
remember,
have an HRA.
right. Right. And that kind of goes into, if you're doing any kind of waivered service, they'll have to have an assessment and then the support plan that goes with it for elderly waiver. That's the clarification you're making.
Yes.
Thank you.
Thanks.
Okay, Teresa, we have Kelsey Peters. Hi, Kelsey.
Can you hear me?
We can perfectly.
Oh, perfect. Okay. So just a quick question. With the EWRS rate tool in the support plan, does that mean that that is a support plan or like a case manager activity then with the new MnCHOICES revision? Right now, that's a assessor activity,
Mm-hmm.
but
It's
I'm thinking that
it's a good question. So when you think about your roles, right, for your staff, you'll want to give them certified assessor and case manager role both so that they can do the support planning and the rate tool.
so it'll remain an assessor activity then.
It can how your agency chooses to do the work is yours, but you'll just make sure that if it is a certified assessor that they add that case manager role so they can do the support planning work.
Just to clarify, that process isn't changing. Our current process isn't changing. Teresa's just trying to describe the rules that you'll need to make sure that you have to continue to do the same process that you have today, but nothing's changing about that. It'd still be a certified assessor responsibility in certain circumstances to follow through with that process.
Got it. Thanks for that clarification. It would be okay if it wasn't, but and then just want to make sure you saw what our we put in the chat, that it would be really, really helpful to have a dedicated launch webinar for the MCOs only.
Okay, thank you. And I will take that as a note.
Thank you.
Teresa, how are we doing on time? Should I keep going through questions?
Let's go through just a couple more. I really want to make sure this is the meat of where they have their questions, and then let's just take two more and then we'll move on.
Okay, so Danetta Waddle, Petrus? Sorry, it's a small area of screen. I've unmuted you, Danetta. Thank you. Oh, she remuted.
I'm sorry.
Hi, Danetta.
Hi. So that last explanation was just a little confusing for me because at our last webinar, it sounded like how the assessor role refers to support plan is not how it's designated in the revised system, where the support plan is referring to what was previously the CSSP. So I'm
Correct.
just asking for further clarification on that because in this new system, the CSSP, aka support plan, is not an assessor role. And I, again, just seeking some
So,
clarification
yeah,
on that.
let me see if I can help you. So for some agencies, based on the type of program, I'll say it that way, there are times when a certified assessor is completing a CSSP, which is now the support plan. For elderly waiver residential services, certified assessors often complete CSSP, which is now a support plan. And there are other agencies where they do both, or they're doing state plan services and do both. So that's why you're hearing us clarify it for those types of questions. Your agency could be certified assessors do assessments, they don't do support plans, and then that just is how you train your folks. So we're just clarifying for those folks where they may wear more than one hat. They may wear an assessor hat and a planner hat. Does that
Gotcha.
make
So
sense?
yes, so for my agency, that would be like initial assessment.
Mm-hmm. For a
Okay,
certified assessor, yep.
that makes sense. Thank
Okay,
you.
you're welcome.
Okay, Teresa, we have a question from Maria.
Okay, and then
Maria, you're unmuted.
then we'll be done for a little while. Go ahead. Maria, are you available? You may be on mute. You may have put yourself on mute. I know Beth moved you off mute, so.
But she just took her hand down. So I
Okay.
will mute you again and we will move forward.
Okay. And folks, if you're sitting there still with your hands up, we'll be coming to questions again soon. I just don't want to get us so far behind that we don't get through all the content in the webinar. So thanks everybody for your questions. They've been great ones. I'm just going to quick advance to the next section. So let's talk a little bit about historical paper documents, and we're going to have this conversation much more in detail at our next webinar. Okay, so this is just to give you an introduction to historical. I've heard you ask this question before, so I wanted to address it again. Specifically, we heard the MCOs ask the question, do we have to scan our legacy documents, our documents that we've been using? And there are no requirements for that. So there are no requirements for counties, tribal nations, or MCOs to scan or load documents into the revised MnCHOICES application as preparation for launch, okay? And so then it has, this includes but is not limited to, you can see the list. What you do need to know for folks who are using the current application, so the MnCHOICES assessment and the MnCHOICES support plan, is the historical data is being captured. Okay, it is being captured. It will live in a person's record in their attachment icon. And there is a list of naming conventions for those files in the document on the slide. So you can go look at the naming convention there. I'm also going to show you the naming convention at our next webinar. The historical data is being saved anytime after November 1, 2019 up to the launch date. And then for that period between April 3rd, which is the launch date, to the dates before the systems are retired, that data will be captured again and have the same process. They'll then put them in people's records and put them on in their attachment icon section of the person's record. And then here's the list of what will be there for data. So contacts for a person, all their assessment contact, and what I'm not going to read through, but I will have you read through when the PDFs are ready. You'll notice for all of these, the status or the disposition needs to be closed for that data to come over, for us to pull the data. If the status isn't closed, the data isn't being pulled and captured. And so again, you can see all assessment content, all CSP content, all CSSP content, all rate plans, and that includes the RS tool content and then the LTSS improvement tools as well. So I want to talk just really briefly about working with each other, specifically about transfers. So there has been some concern about how we are going to do transfers when we launch, and we're letting you know that we are going to continue in the present mode that we have been working with. So transfers between lead agencies will continue using that DHS 6037 form, and any changes to that transfer form will be done prior to launch. And we are asking MCOs then to create an MICP contact for their agency so that who to contact is available when you use this DHS document for transfer. To remind folks, what the heck is an MICP? It's a MnCHOICES interagency contact point. It's a way for lead agencies, counties, tribal nations, and MCOs to contact each other and to transfer people to each other. So that information includes a secure phone number, an email, and a fax number. And it doesn't replace any other kind of mechanisms that you'll use, but it is a system that has been in place for a number of years, and agencies, counties, and tribal nations are used to using it, and we're looking forward to and welcoming MCOs to join that agency contact point list, so to improve, facilitate transfers between counties and tribal nations and managed care organizations. So where you'll find that information is when you go to County Link and you choose the MnCHOICES mentor page. It is under the mentor resources, and you'll see that it says MnCHOICES Interagency Contact Point MICP list. To update it, you'll use the update agency contact, and then this is how agencies are updating. For MCOs who haven't done this in the past, I'm asking you to pick a contact point person by March the 1st and to enter the data into this form when you've set up what you're going to use for your agency contact information so that it is available and ready to go by April 3rd by the time of launch. And this is what it looks like when it is on the County Link page. So it will give an agency their phone number, the email, and fax number, so that when people indeed need to do a transfer and they need to know how to get in contact with an agency, this provides them the information they use when using that DHS form. And want to share that transfer communication information. So I also had some questions. We're still in the kind of questions you had at the last meeting. So let's go through and talk about them as related to documents. So there was a question about downloading Help Center documents, and I just wanted to clarify that. So when you go to the Help Center and you see a document, you can view it or download it. If you view it, you can't really search for keywords is easy, so you could choose to download. I just want to caution you that if you do download, always go back to the Help Center to look at the document. Don't save the download and use it. We really want to make sure you remove those downloaded documents after each use, just to make sure that you're using the most recent information and that you don't end up using old information. So that's my only caution for this one. If you choose to download a doc so you can look at it and use it easier, make sure you get rid of it when you're done, because you don't want to then come back and use old data when we've updated the document. The other piece that I'm going to talk to you a little bit about today, but as you heard, it's my intention to talk to you more about it in the very near future. Last meeting, we talked a little bit about the current functionality and future enhancements document, and I walked through several defects and workarounds, so ways that you would work through the current functionality in the system and to do your work with directions on how to do it while that functionality needs to be resolved. And so the purpose of this doc really is to help you get a acquainted with those in MTZ so that you're comfortable with them prior to production. And this is really just a description, a list of known issues and instructions on how to complete them in the production environment. And so one role that a mentor has, especially for new MCO mentors, is to really understand this document, help your staff to understand this document and use it. And so, like I said, we'll look at walking through it again in detail again. But I just wanted you to know that's the purpose of that. So when you see it come up on slides, and if I show you something related to it, these are places where there is a known issue and there are directions on how to move forward on it. And that current functionality and future enhancements document will live in the Help Center. You'll see the date that it's been updated or loaded to the system. And so you'll be able to use it. So questions that we've been asked are about having what I call blank documents. So documents that don't have any information on them because for very specific reasons. So for both assessment and HRA, we will have those forms available. For the health risk assessment, it is really for people and professionals who need to see a blank document. So if someone asks you that they would like, the public would like to see a blank document, but it's not meant to be used to go out into the field and do assessments. It's really just available for, let's say, appeals if they needed to see it, if a person wanted to see a blank one, other reasons like that. But it really is informational only. And again, it's not intended to conduct a MnCHOICES assessment. So that you're aware, you should be taking an assessment offline and doing it that way. The health risk assessment will also be blank and available. We've heard MCOs asking for it specifically for auditing purposes, wanting to be able to look at a blank. So we're working on having that form posted as well. It will be called 6791H for HRA. And so when it is available, we will let you know, but we wanted you to know, yes, we were moving in that process and they are both getting closer and closer to posting. So there were some pretty basic access and navigation questions. And so I just wanted to make sure that we went over them since you're just starting your training for your staff. The one thing I want you to note is the screenshot is the agency login page. Prior to it, you will have logged in as yourself. You will have put your EXON or PW number in there and your password. You will have hit the acknowledgement page. If you work for more than one location in your organization, you might see this page. You may also see it when you use change context. We've specifically talked about this for people who, like Thomas Allen, Meridian, Lutheran Social Services, other folks like that who may be working for more than one agency. They'll be coming back to this to change who they're working for. And so that's what we're going to talk about just a little bit in a minute. So first, let's start and talk about user access in the production environment, because I have heard several people say, hey, we've already sent in our onboarding spreadsheets. How do we update them? We know that things will have changed by the time we get to launch. At launch date, your security, your lead agency security admin, your security liaison for your agency will be able to go into the system and add users directly and then submit a ticket through the Minnesota Services Hub to request user access. And then the SAM team will verify they've taken their data privacy coursework and make them active. And if you want to learn more about that, or if your security liaison would like to learn more about doing that, whoever has that lead agency admin role in the system, you can use this document, the Smart Guide Production Adding and Managing User Access. Again, we just added that Smart Guide, that updated Smart Guide to the Help Center, MTZ Help Center yesterday. And I'm also going to set aside, as you saw in an earlier slide, some time for security liaisons to talk that through later in our launch process. There's also in the Overseeing MnCHOICES Trainly course, a course for production adding and managing user access, so they can take that as well. But you will be adding your own staff to the system, putting in a MnCHOICES, in a Min Service Hub ticket through the SAM team, through your security liaison. They'll verify, yes, that person has access, and then the person will have access. You will also be able to manage or make changes to user information in the system itself at launch. So change context is what you heard me talking about earlier. So let's say I work for, we'll pick on poor Thomas Allen. I work for Thomas Allen and I work for 3 other agencies. When I log in, I may log in as one agency, but I need to change and work for another. That's in my, when I will pick in my profile, I'll pick change account context. And what it will do is it will take me back to the agency login screen. And then I will change my organization that I work for, and then I will pick my combination, and then I will be able to do work for that agency. And it's important to know we really want you to use that process if you're a county as a delegate to an MCO, for example, or if you work across several agencies, that you always do this, change your context and work for the agency you're intended to. It keeps the records clean so you can see kind of what you're doing for that lead agency you're working on behalf of. It makes auditing and reviewing documents more accurate. It is the way that you should be doing workflow. If you're not doing it that way, it is going to cause problems for the lead agency. And so we want you to be aware of that. This is the best practice. This is what we expect you are doing. So let's see where we are at for time. We've got an hour left. I have about 34 left. What I would like to do, if I can, is I will take 4 questions and then we should probably move on. So I'm sorry for that, but I just want to make sure we get through content and then we can pick up questions after that. So Beth, if you can, we can do like 4 more people, then we'll keep going.
Okay, first in queue is Annie Brown. Annie, you're unmuted.
Hi, this is Annie Brown from Brown County. I'm just hoping that I understood correctly, or wondering if you can provide clarification. When you were talking about the updating the interagency contact point, and then you were talking about transferring, what types of things are you talking about transferring through the interagency contact point?
Don't get caught up in that detail. All I'm doing is telling you that transfers don't change, and I'm asking the MCOs to add themselves and to add an MICP contact. More than that, the process doesn't change for counties.
Okay, because I thought it's not the role of the interagency contact point to receive case transfers. So
it may be that I should have titled the slides differently because it's confusing because of that. And we missed that detail when we changed the transfer information, because in your case, you're talking about reassessments. And it doesn't speak to reassessments. The reassessment process doesn't change either.
okay, so we're not necessarily talking about ongoing case management transfers. You're just talking about MnCHOICES information transferring.
Yeah, Annie, it's a really, really good point. And I'm just going to put a note that I need to clarify that better next launch webinar, because I think you're right. I think I put apples and oranges in the same basket and called them pears, right? And it's not the same.
Okay, thank you.
Yep.
It helps if I'm unmuted. Ashley Siegfried, I've unmuted you. Hi.
Hi, can you guys hear me?
Yep. Thank you.
Thank you. I just need clarification on when you mentioned about attaching docs, that we don't need to attach documents in the revised MnCHOICES, like such as the 6791, the 2727. So will those docs be in the revised MnCHOICES for assessors?
So what we're speaking about is historical data only, okay? So all I was saying to you is there's a concern, will agencies need to load historical data into the revised MnCHOICES application? And we're saying no. If they are in the support plan computer application, the data will be loaded into PDFs and put in the person record. If they're on paper, we aren't requiring anyone to load them and they won't be there.
Okay, thank you.
Yep. Yep. No, you're welcome. Sorry, I just wanted to make sure I was clear. Hopefully that cleared it up.
Well, can I ask the next question, follow-up question then?
Sure.
So if, will assessors have the ability, or case managers have the ability to attach documents such as like the release of information, the 2727?
Yep.
Okay.
Correct. Yep. Yeah, when you take your access and navigation course and you look at the attachments, it will talk you through that. So yes, you have the ability to upload a form and put it in the attachments. Yes.
Thank you.
Of course.
Okay, so next we have Kathy McMahon. You're unmuted.
Oh, thanks. I'm interested in going back to that discussion of adding new users. And I'm also thinking of that in a similar way as assessment assignment, that it would be nice to have all of our users in the tool on the first day, because we've had a lot of new employees, you know, since last year, and or since what the, I guess whatever the spreadsheet that we submitted, when was that, in the summertime?
No, in October, but yep, it felt like the summertime. Yep.
Yeah. So if we submitted it on the day of launch, could we get the new users in there on the day of launch?
No, so we can't use the onboarding sheets to load new users. They have to be loaded into the system. But I think your question, Kathy, is there a way to get access prior to launch to add your users so you're ready to go? And if you haven't created that help desk form to ask to put the first piece in, put this one in there too, please.
Yeah, I'm happy to do that.
And specifically, if you can put in like how much time you think you would need, that would be useful for us to have collected that information.
Thank you. Sounds good. I'll do that.
Okay. Yep. Thank you.
Okay, our fourth person was Sarah Gibson. I think that there was another person that might have, oh no, raised their hand after. But Sarah Gibson, you are unmuted.
Hi, can you hear me?
I can.
Okay, great. My first question was just answered by the last question that was provided, but the other question that I had was for state plan services. So since CFSS is not going to be implemented until later in 2023, does that mean then because the revision system already has CFSS, that the workaround is still going to be required so PCA can be accessed for the next 9-10 months, however long it's going to take for the CFSS to be approved?
Beth, I'll have you answer it.
Yeah, we will have a worksheet for you to use. It's in the system. You're just really converting, if you're just double checking 3 healthcare ratings, so PQ or R, and whether or not they would be considered an actual PQ or R under PCA rules, or if they're LT. And so the system will change that for you and give you directions.
Okay, thank you.
So yes, we do have a workaround for you. It should be pretty easy. Thanks.
So are we at the 4th person?
Those were the 4 people.
Okay, I'm going to keep going just because I need to make sure we get through the rest of the content. So we're going to take a little bit and talk about data pulling over from different forms to others to make sure you just get a sense of that and have that somewhere where you can use it if you would like to for training for your staff. This is the list of the ones that I have, and these are the ones that we're going to walk through. So for MnCHOICES assessment for data, copying over, what will happen is when a person chooses reassessment for the assessment type, you're going to get a question. If there is an existing assessment, do you want data copied over from the last assessment? And you can pick yes or no. If you pick yes, it will copy over from the previous assessment, including if you had one that was incomplete. So it's going to go in order. And so the last MnCHOICES assessment is what it's going to copy from. So you're aware. And then what copies over? So all the functional assessment sections copy over, and what you're going to see is like a dotted line with copy from previous assessment, so it's clear that it's copied over. So you'll be able to see, and then you can basically highlight that and delete it, make any changes that you need to it to update it. And then for each of those areas, those functional assessment areas, you're going to get a screen that looks like this. And it's going to say to you, have you reviewed and updated these? And then when you have reviewed and updated the data, then you'll click them. And that will be included in the completion requirements to say, yes, you've done that, so that you're aware of that. And what doesn't copy over? So the initiate assessment doesn't copy over because, again, this is for a reassessment, so you need to fill that data back out. The activity information, the assessment results, assessment summary, assessment results because you have to run the rules again, assessment summary because it is the CSP and it needs to be updated for the current assessment or reassessment, and then the screening documents, of course, will be populated based on the assessment results. So those do not copy over from the previous assessment. The health risk assessment, what copies over? So when a new health risk assessment is created, data will copy over from the most recent complete status, and then here's the list of what will copy over. So the assessment information, living situation, everyday life, my health, staying healthy, and safety and well-being will copy over. So what data copies from a support plan, an HRA, sorry, health risk assessment, to a support plan HRA, so the support plan that's associated with that document? So what will happen is the data will copy over, and it will also, in some areas, which I'll show you, and then it will also be available in the care coordinator next steps indicator report. And so that will give you some of the comments and other things so that you can review what you learned from the assessment there, but you can also go back and view the assessment. It will show, or the health risk assessment, just to make sure I'm use better language. Even if it's closed, you can click on it and view it. And so you could have it on one screen and you could work on your support plan and the other screen as well. So this is what the next steps indicator report looks like. And so you'll see that you get some narratives and you find it by when you go to the support plan, you choose print, and then you can see it in the drop-down list. So what data pulls over from an assessment to a support plan? In this case, data that comes over from assessment to a support plan are the housing, environment, and needs, but no narratives pull over. And it also applies to the MnCHOICES assessment with the staying healthy domain also, which means so whether it's a MnCHOICES assessment for a county or for an MCO, this is what we'll copy over or will be pulled over. The reason why you hear me using different language is because copying is from one assessment to another specific to this application. For support plans, data is pulled from assessments, so not all data is pulled over. And so we use those two different terminology to kind of differentiate that. So I'm sorry if that causes you confusion. It just makes it easier to understand the differences. So you can, in the reports in a support plan, do the supplemental summary chart, and you can use it to review information from the assessment. So you can look at all of the text boxes and get more information. Or again, you can go to the assessment and open it up and view it. If you want me to, I can demo it later. I can show you that print button and show it to you, but it is something that you could do for yourselves. Go out and look at it. And it looks like, I just got to see where we are at. We're at 45 and I have 15 left. I will quick show you what it looks like. And then Beth, if you want, let's do another 5 questions and then, oops, we can go on from there. I'm just logging in so I can show you where that
While
sits.
you're
But,
logging in,
yep.
we're just getting lots of questions about the PowerPoint. And so what's our plan for the updated PowerPoint?
My plan was to have it posted today. There have been some changes in how that is done. We're kind of down some resources for that. And so I'm waiting to see when it is posted. It will be posted to the training archive. I don't have an ETA on it yet. I checked on it again this morning. We could send out a communication and let you know if that's something that you would appreciate. And I can go out and check and see if it's been done as we get to the end of our presentation today too.
Sounds great, Teresa. Thank you.
Sorry, I'm just bringing a person up. I'd like to think I can do 2 things at a time, but I'm really listening and then clicking. So it's not happening quite as fast as I'd like it to. So let's see. I don't know if I'm going to have such a pretty one to provide you, so please forgive me on that one because we do so much testing in here. Who knows what I'm getting?
So I
Go
can
ahead.
answer a question in the interim while you're going through. And is that okay? It's about the copying. So they're wondering if we create a reassessment in the revised MnCHOICES, will that data that currently exists in MnCHOICES copy over to the revised MnCHOICES? And what you said is no. You'll get PDFs from our current MNA and MNSP, and it'll come over into the revised system in the PDF. Once you enter your new information in, that information will copy from plan to plan. So I think that's what you heard Teresa say today.
Thank you, Beth, for saying it again. Sorry, I'm gonna go. I need to go to the assessment. So this screen was specifically talking about the assessment view, and I was putting myself in the. So I don't know how much I'm gonna see. So if you're in the assessment and you're in the supplemental summary charts, you go to print and you click on it. I just want you to get a chance of it. So it'll show the narrative summaries so you can see it, but it will also show you the ADLs chart, which is useful. So you can see all of this stuff. And so I just wanted you to see it because it's a nice tool for kind of, accessing what you might need to see in an easier way. So I wanted to show that to you. So go ahead, Beth. You may ask some questions or have some folks ask some questions.
I do see something in queue. I just want to comment really quick that Christian Rhodes said that she was able to get the PowerPoint from an email that was sent yesterday. So folks might want to know that as well.
So it may have went out as part of the webinar registration if you registered for the webinar. I just haven't seen it as a PDF to send to you separately. So, okay. Thank you for that. Thanks very much.
Yep. Thanks, guys. Okay, and then so we have a question from Jennifer Vandershaw. And so Jennifer, I'm going to unmute you. There you are.
Jennifer, are you there?
Can you hear me now?
We can.
Excellent. Okay, so my question is specific to those completion requirements. we've been working within some of our fictitious parties, and we show the completion requirements, and we see, okay, functional assessment, we are missing information in the staying healthy section. And go through every portion of the staying healthy section, and every button has a response in it, and every narrative box has a statement in it. How can we tell what we're still missing?
So I have seen this sometimes happen in that staying healthy section where you have answered a question and saved it or thought you saved it. So I can't speak to which because I can only thinking about myself, right? And then the question reverts back to not answered. And that's so I go back and look for the ones where I've answered the question, because it's often that's what's happened in that section. That's what I've seen. But if what you see, for example, let's say you go in there and you see that and you answer it and you save it and it comes back and populates it unanswered, then if you could please turn that in on the help desk form, that would be useful. It may be something that is unique to MTZ and not to production, and we would just want to verify that for you.
Okay, I thank you. In having that, we do have multiple eyes on, and we've one in particular, and there is nothing that's reverting to unanswered. They all have the green checkbox on them. So I mean, that's kind of our frustration point is
Yeah.
at least.
Can you give me the? Can you send me the person? So can you send me a help desk form that says the person and the person's ID number, and then we can look at it specifically?
I sure can.
That'd be
With
great.
that, you want that in the going through the current help desk form?
Yes,
Or,
please.
okay.
Yep.
I think that there is currently something that we're working on regarding the completion requirements and staying healthy. And I think that it was confirmed for us again last week during our user acceptance training with lead agencies.
Okay.
And so, yeah, we understand that when you get there, that's very complicated or very frustrating. So.
Yeah. So what you hear Beth saying is
Working
they've
on it.
noted it as an issue.
Okay. And you still would like me to send this particular example in?
Let me ask, Beth, do you think we need it, or do you think you guys have it documented as part of UAT work?
Yep, we have it documented as part of work, and it is, there's a fix coming for it this Friday. So it's on its way.
All right. So, obviously we can't get past that when the completion requirements are not met. Do we then need to create a new fictitious person to actually get past that? Or are we just waiting for the workaround?
If you wait for if you wait until the all clear on Monday after we've done this release, if you discard your assessment, create a new assessment. You don't have to create a new person. Just discard your assessment and create a new one, and you should be able to get through it start to finish.
And you could copy it, choose the reassessment and copy it.
And when you create a new one, it'll ask you the question, do you want, if there's previous assessment information about this person, would you like this information to copy, yes or no? And so you can say yes, and then you'll get to see what a reassessment looks like too. So.
And so the other piece that I want to clarify in what you heard Beth say is MTZ releases occur on a schedule. And so what you're hearing her say is that they will do a release to the environment is already scheduled for that. And then that will then be the fix. And then so when that occurs, then you can go ahead and do that.
Okay. So nobody should be working in the training zone until after we get the all clear for that particular part on Monday. Is that what I'm hearing?
What we say for.
Hang on just 1 second.
Yeah.
Teresa, I'm thinking that the release that I'm thinking about is coming Friday for UAT. But we would have to look to see when MTZ is done.
It's right here.
Right?
Yep, it's right here. So in the MnCHOICES County Link page, it notes when the UAT release is happening. and it notes when the MTZ releases are happening. And so it usually happens, MTZ happens the Monday after the UAT release. I don't see next week on the list, but you're hearing Beth say, yes, there is going to be one. So I would say yes, wait until after Monday and then try it for that specific instance.
Okay.
But otherwise, you can go ahead and use MTZ.
Okay, thank you. And then we also came across an error where it would not allow for saving in the narrative section, and the error that came up said object reference not set to an instance of an object.
Oh, interesting.
And I can't figure out what that means, but we did abandon that that assessment and then created a reassessment, and we're able to enter information in that same narrative section, but I could not find anything about that particular error.
Yeah, it would. The only thing I could think is, go ahead.
Oh no, well you might see an error sometimes, and you'll get this carry box that's on the side that says error not known, and it might be something in the back end happening with the system. And so typically logging out and then logging back in, you don't even have to redo your assessment, and it should come back and you should be able to work. But sometimes it requires a log out and log back in.
And obviously that was the first
thing
that they did was log out and log back in. But the second workaround was to abandon.
Yep.
Close it. Is there a document that currently has all of the error pop-ups that might come up that we can look at and say, oh, that's usual. I have to log out, or I have to wait for an update, or I need to make a help desk ticket in regards to this particular error?
So we don't
see
currently.
those.
Yeah, I think we want to see them because usually the error messages are descriptive enough so that we know what's going on. In this instance, it doesn't sound like it was, and it would be worthwhile for you to submit this one in.
Okay.
If you see it again.
If I see it again, okay.
Mm-hmm. It may have been unique to that time. It could have been about the, slowness of the internet. I mean, like, who knows what it was caused by. It could have been copying and accidentally, where I would expect to see it, but I don't think you did this, is if I copied something over and it copied like computer code and the system said, oh no, I don't like that. That would be an instance where I would expect to see something like that. But again, just if you would, just submit them into the help desk so that we're aware of them. Give us the person ID, what document did it happen in, and kind of what field, and then give us the steps to create that error so that we can try it too.
All right, thank you.
Yep.
I just want to clarify too that error messages aren't super common in the system, and sometimes it happens. Another reason why you might see it is I used to get really click-happy with my save button, and so just making sure to give the system time to do it is something that's good too. Of just kind of as you're going through, taking your time to select it once so that you're not getting in multiple messages. But it's not very common. I really don't see a lot of those kinds of error messages, and usually I know why I would see one, and it's because I went through something too fast.
All right, thank you.
Yep, thank you. Do we have other questions, or should I move on? Or have we had our 5?
I don't know that we've had 5, but I don't have any other questions for you
okay.
right now.
Okay.
There's questions in chat that we can attempt to if you have time.
Okay. I just want to make sure that we give time to all of the slides. So, okay. So, let's see. Now I'm specifically going and talking about support plan and what data pulls over from a support plan. And the reason why we left this separate was to give you a chance to get your heads around the assessment data before we went ahead and went to the support plan data. So just so that you're aware kind of what we're up to and why. So let me, sorry, I'm doing some background work here to make sure that I know where I'm at. Okay, I'm ready to go. Ignore that. So what data pulls over to an existing support plan? So for people who have been working in the MnCHOICES support plan application, you're used to creating a CSP and then creating a new CSSP and having the data pull over. In this instance, how you, we're going to talk a little bit about a new form using the create new form or using the revise function to teach you how to pull data from one support plan to another, okay? So the first thing you need to know is MnCHOICES will pull data from the assessment with the same type. So for example, if I'm creating a support plan, or if I have a support plan and I call it a support plan HRA, then it's pulling data from the HRA. If I do a support plan and I ask it to create a support plan for the MnCHOICES assessment, then it's pulling data from the MnCHOICES assessment. If I create a support plan and I say, hey, I need to create one for MCO MnCHOICES assessment, then it's going to pay attention to that one. So it knows based on the type that you choose where the data is coming from. Okay. Also, the assessment must have a status of complete or approved to be able to have anything pull over. And the piece that you need to know is when you go to the form section of the application in the person record, sorry, it will not pull new data, will not pull data from the previous plan. So if you create a new CSSP, a new support plan, it will not pull the data over. What you'll need to do instead is to go to the existing support plan that has an approved plan status and choose revise, and then it will pull data from that support plan to the next support plan. And I'm going to show you that just real briefly. And we've added this functionality to the support plan workflow modules in the to make sure that we address it in detail. Or I should say we're adding it. I'm adding it this week, so it should be up and ready sometime next week. So again, if I go to new form and click new form and create a support plan, the support plan data will not pull over from an existing support plan to a new support plan. Okay? It does not pull over. So when I have a support plan with the status of plan approved and I need to revise it or edit it, then I would choose revise. And when I choose revise, the MnCHOICES tool will pull the data over from the support plan that had an approved status, and that then the new support plan will move to in progress. And then when you move the status from the support plan from in progress to in progress assessment complete, then it's going to pull the assessment data from the last assessment, from the most recent assessment. So it's going to take that two-step process like you're learning to get used to, right? You'll create in this case, you'll revise a support plan. It will create a new one. That support plan will be in progress status. The support plan data will have pulled over, but when you hit submit again, and move it to in progress assessment complete status, that's when the assessment data will pull into it and it will pull the most recent assessment data. So just so that you understand that. And so how will you find revise? How will you know how to use revise? What will happen is when you're in a person's form screen, you'll use the little filter button at the top and you'll filter for support plan. And when you filter for support plan, what will happen is it will display only support plans. You will see the plan with the approved status, and you'll have paid attention because you may have several plans with approved status. You'll find the plan that you want to revise. You'll, at the ellipsis, choose revise. Okay. When you choose revise, it's going to ask you, it's going to open this revise window up, and it's going to ask you which one of these do you want to use. You can choose any of them. I've just highlighted plan revision. You'll know what the purpose was for choosing revise. Is it a reassessment? Is it initial, or are you doing a plan revision? And you'll pick the reason that works for what your work you're doing. And when you do that, it will create the next support plan. So it won't open up the existing support plan and have you revise it. It is going to create an additional support plan, and then it will pull the support plan data over once you make that decision and hit next. So again, what's going to happen is the assessment data isn't pulled over again until the status moves from in progress to in progress assessment complete. Just like all support plans, when you hit the submit button and it makes this change, then it pulls the data. And then again, you will, so it knows which data to pull, then you will tell it what support plan type you want. So if you were doing a support plan for a health risk assessment, when you make that choice, it will then know when you make the change the status, it will pull from that that assessment type. So just so that you're aware of, again, the system's smart enough to know you're asking for a revision, you're asking for a revision for a support plan that's associated with an assessment. When the status changes, then it'll go and pull from that assessment because that's what you've told it. You've told it which assessment to use. So the bigger question is, what is retained from the previous support plan to the new support plan? So this is the data that's retained so that you're aware. And the data that's not retained is all the service planning data to determine rates is removed. The support plan signature sheet and signatures are removed, and the assessment pre-populated fields are removed because it pulls from the most recent assessment. So it will, when it's in progress status, it will remove that. When you move it to in progress assessment complete, it will pull it. It will pull the most recent assessment data. So one item in here that is in the current functionality and future enhancements document that we're creating for publication in January is that piece where service line dates and rate inputs aren't going to copy over from when you choose revise and it creates a new support plan, it's not going to copy those over. So the user will have to add service line dates and rate inputs and rerun the rate again. And that is something that will be fixed future. But we just wanted you to be aware of that occurs. So let me see where I am. So we have time for any questions people have till the end. My last remaining slides are to remind people on where to find information and some of the basic terminology that I always have at the end of the slides. So I can take any and all questions until we run out of time.
Okay, our first question is from Debbie Ackerman. Debbie, I'm going to unmute you.
Hi.
Hi, Debbie.
My question is related to people who receive DD case management but do not have a current assessment in the new MnCHOICES support plan application or the tool. So, for example, people who may have had a MnCHOICES in the current system, but moving forward, their family is choosing, they or their family are choosing to waive their assessment annually, but we need to create a support plan annually. Or people who we haven't quite yet brought into MnCHOICES. I know last year we were told that we would be able to create support plans for them in the new system without a MnCHOICES assessment. Is that going to be the case with this launch, and will there be more direction about how to do that?
that is the case, you will be able to create a plan with the transition reason. And as far as direction goes, I don't know if any of our support plan folks want to
Well,
jump
all I
in,
was
or Teresa.
Yeah, all I was going to say about that is next month we're going to talk through transition expectations, and in that we will point to the practice guide for support plan with transition reasons and talk a little bit about it there. So we could wait and have a conversation more, and you're welcome to bring that question back up, but there is direction in the transition information, and it points to the instructions you need to complete it.
Okay, thank you.
Mm-hmm. Sorry, we can only get to
Next
so many
question.
topics. We can only get to so many topics per webinar, so.
And we know you're curious,
Yep.
so we'll get there. We'll get there. Jessica Mickelson, I'm gonna unmute you. There you are.
Hi, sorry, I know Teresa, you already touched on this and I just didn't fully understand what you were saying. So can you clarify the onboarding process for new users? So they weren't included on our onboarding sheets in October.
Yep.
When will we be able to add them? And I know that'll go through the security liaison. I know I'm gonna watch or complete the MnCHOICES 9:30 training in TrainLink, but just wondering if you could review that again.
Yeah, I'm happy to talk about it. So any new users, any changes to users, maybe you need to also have someone taken off the system. You will use the smart guide that I mentioned, but what it'll basically mean for adding users is that your your lead agency security admin can add a user into the system. Then your security liaison will submit a ticket to the SAM team. The SAM team will review the person's data privacy coursework, make sure everything else looks like it's supposed to, like the PW and X1 number are correct for the person. And then they will activate the person's account and they'll get an email. And so that's kind of how that will happen. And that will happen. Go ahead.
When can we do that? So let's say we had a new person who's completed.
Yeah, right now we're saying at launch date, April 3rd is when you can start doing it.
So we have to wait until April 3rd.
Yeah, and if you heard Kathy say, gosh, we would really like for that to be different, you're welcome to submit that feedback in as well if you would like to.
Okay, thank you.
Yep. Hey, folks, so Beth, let me say one thing regarding the PDFs.
Okay.
The TTC team sent out the PDFs for the people who registered for the launch webinars. So if you want to make sure you always get them at a time, if you go to TrainLink and pick MnCHOICES in the search and choose launch webinars and register, you'll always get them that way. I just got the PDF in my email, and so I will have the help desk send it out to the mentor list after today's call. Except for if I do, it won't have the updated slides in it. So I'm happy to send it as is, but the ones where you've seen it said updated or new won't be included in the slide deck. But you'll be able to get it from once it's updated in the DSD archive page.
Okay, we have a question in queue from Sue Nelson. Sue, I'm going to unmute you.
Oh boy.
Hello, we can hear you, I think.
Oh, you can hear me?
Yep, we can.
Okay.
Just so that you know.
Okay. There's always seems sometimes they switch the audio somehow on the computer. But anyway, support plan and moving data, just to clarify, and again, I haven't practiced in it lately. We have a plan where we're going to start working and going back into the training zone again here. But if I'm doing a reassessment, any type, I get my assessment done and it's completed and I go to the care plan, then I can click on revise and it will bring in the info from last year's care plan?
So you won't have anything if you're doing care plans, you're working with managed care, and there isn't any historical data there for managed care or any historical data from the assessment or support plan applications that pull over. So all that historical data isn't there. So for your assessment when you start putting your assessments in the application, then you'll create a new support plan. What this is in reference to is future support plans where you need to do revisions. And part of why I highlighted it is so people were aware that creating a new support plan will not pull data from the previous support plan, specifically because users of the MnCHOICES support plan application are used to that functionality. And so it's a new way of doing business for them.
Okay, so let me repeat that I understand. I didn't think about that. Obviously, there's no historical data. So let's say we're a year into it now and there is historical data. Then when I click on support plan, it won't carry over like it used to. But if I do revised, then I will get last year's data auto-filled?
Correct.
Aha. Okay, that's what I was wondering. Thank you.
Yep, you're welcome.
Okay, Teresa, we have a question from Giovanna. I'll unmute you. There you are.
Hello, it's me again. So I'm just thinking of how assessors work here, and my question is if assessment is marked complete or oh, what was the other one? So let's say we do the assessment fully and we complete it. Is it possible to make any alterations after that? The scenario I have in mind is, again, we have customized living ready to accept someone, but then we don't know the date, or depending on the rate, they say yes or no, which means we have to do the assessment, apparently a support plan as well, and the rate as well. And we don't know if for now we can make some adjustments again because the rate is, we are able to get the rate in the CSP itself. But I don't know if that can be done in the future. So I was just wondering what that would
what will happen. Yep. So Beth, do you want me to take a shot on, or do you want to talk about in those instances the assessment status and reopening, or how would you like to move forward with that? Because I can talk about functionality, but I don't want to overstep the policy side of it. Do you want me to make an attempt at it?
I think just talking through the functionality, this question would be okay, and then Savannah can ask clarifying questions.
So I'm thinking about it in a couple of ways, and then Beth can give her 2 cents on it, okay? So I'm going to talk about it purely from the functionality standpoint, and I'll let Beth talk about it from the policy standpoint. So when I think about it, you heard me say that a support plan will take data when an assessment is in a complete status. And so complete doesn't need to mean that the assessment has been approved, because when it's approved, it's closed. You can't make any changes on it. So could you leave it in pending MMIS or some kind of pending status, but that's still considered complete? Go work on the support plan and do work on it.
Okay.
It would still pull the data over, but that's why, Beth, I want you to weigh in on that. Or would you prefer they have it in approved status, it's closed, and they reopen it? That's my question.
Your work will be cleaner if you have the assessment in approved status, and then move the support plan into assessment approved status. You can open a support plan and you could be working in that support plan with the assessment open. There's just certain sections you won't see because that information is going to come over from the assessment, right? So your needs are a really good example. Any kind of needs that might be there that you might tie to a goal or tie to a service but yet you're able to get started on your services and your rates prior to the assessment being finished. But I'd recommend, I mean, as you can wrap up your assessment, make sure you're having that communication, make sure the case manager is looking to see what they might need to do, or if things are different, you know, to have those conversations with the assessor to make sure everything is working out, and then the assessor can close their work, and the case manager can move on with theirs.
Okay. Okay, thank you. And by the way, thank you for answering my question before that. I just muted myself by accident and I wasn't able to say thank you.
You're welcome.
Oh, and thank you for the
Oh, Jolana, that was me. I'm so sorry. Oh, I'm sorry. Okay, so our next question is from Sarah Gilson. I am new to this whole unmuting thing, so I appreciate your patience with me. It'll get better, I promise. Okay, Sarah.
Hi, yes, I haven't looked at the training zone area since last or 2 falls ago when we were actively going through those. But for clarification with the intake process, if I remember right, individuals aren't able to have an intake sitting as pending, like they have to accept before their information's really even able to be entered into the system. Is that correct?
I'm going to let you answer it, Beth.
So intake is different in the revision. You are able to enter in person information and then even initiate an assessment. So there's not that intake process that you had prior, that you do an intake to assignment, you know. But I feel like that could be a whole another topic that we could have with you guys.
And I would
you know,
appreciate if it was.
Different. Okay.
Because that would just help us streamline how we're actually going to implement that within our agency, and if we're changing how intake per se is done here, or adding staff, whatnot, that would be really helpful because it's super confusing right now.
So in particular, do you want to submit into the help desk form kind of where you have confusion and would like clarity? That would help inform our PowerPoint going forward. Is that reasonable to ask of you? I just feel like I want to make sure that we address where you have issues. Is that fair?
That's understandable. It's just, I feel like counties are kind of just at their own figuring out what their process is going to be. And I know you guys can't streamline everything, but it's getting real confusing for all hands on deck. So
right. So what I hear you saying is kind of like timing. When do you put the person to the system is one of the questions. So those are the kinds of things that I was thinking about. If you could say, here are the places where we're having conversation and are unsure, then we can make sure that we try to address them. Does that make sense?
Yep.
Okay. Just want to be helpful and I'm trying to make sure we address what you want to address.
Yep, I appreciate it. Thank you.
Sure. Yep.
Okay, Jessica Nicholson.
Well, I just had a response to that last conversation about intake. And it's been a while since I've done the trainings myself, but I think our agency had planned for our intake worker to just complete the health questions and then the person information. So I don't know if that helps the other agency that was questioning how intake would look, but our understanding is that it would be a little less time intensive for our intake worker. And that there would just be 2 sections in revision that they'd be completing prior to us getting it ready to be assigned. I don't know, Teresa, does that sound accurate from what we had talked about last time we were going through our launch?
Yeah, so I'm sorry, say again, you were saying the health questions and
the person information, so the demographic information.
Yeah, And that's kind of how I've been talking about it in the training. When I've been thinking about case aides, especially who may, or support staff who may be doing it, you'll hear in the training itself where we'll say, hey, do it, have this person do it this far. See if the person's in the system, update their profile. Again, make sure their health status stuff is entered, have their person information done, and then that person is far enough along that you can assign them. That's what we've been saying to date about it. But it feels like there's a piece missing, and but thanks for reminding me of that. Much appreciated. So next
Okay, Teresa,
question.
we had a question and then she took her hand out.
Yeah, and we're right at almost at the top of the hour, but I'm happy to take one more.
Kristen Rose. Here we go. You are unmuted.
Be pretty quick, but I did type it up in the chat. But just to confirm on the revised versus new support plan, to potentially make it easier, that the new should really only be selected if the person has never had a support plan in the MnCHOICES revision application before. Is that correct? That revised could be used for any ongoing.
Beth, I'm going to let you or somebody at policy answer, because is there ever a time where you don't want them to use revised to keep using the older support plan information? And I feel like that's a policy, not a functionality question.
It is a policy question, but I'm not sure if other folks that are on the line at the moment.
Yeah, I wonder if we need to come back to it
for me, or if we could come back to it.
Perfect.
Yep. If you put it in the Q&A, then I will pull the Q&A and look at it for, anyways, I always do for the next webinar.
Yeah.
And we can revisit it.
Perfect. Thank you very much.
Yep, you're welcome.
Teresa, we are at noon, but we have one more follow-up from Jennifer Vandershaw.
Okay, we'll take that and then we'll pull the Q&A too and make sure that if we haven't addressed your questions this time, that we'll do it in a future webinar. So go ahead, Jennifer.
Awesome. I'll be very quick. This one's not really a question. It's just a request for an enhancement in functionality as far as for ease of all people when we're initially starting people to be certified assessors moving forward under the revised MnCHOICES. Could we have that in TrainLink as the full course track where we don't have them going through multiple courses, but rather just like you have updated the recertification process where they say, yes, I want to be a MnCHOICES assessor, and then all of the modules are under that, rather than course this, course that, and then the next where you're kind of jumping around and having to find them. Would that be something that we could request as an enhancement in the future?
So here's the question for me on it. I think what we're talking about is just a temporary because we launched later and some people took some things before.
Absolutely, absolutely.
Right?
That's one consideration, but there's also the consideration of, if you're looking at it for the future, why should there be multiple places that you have to look to find out, oh, have I met this prerequisite, because you searched for all MnCHOICES and maybe you didn't find them in the correct order, because let's be honest, they're not right in an order when you're searching TrainLink.
No. Right. Well, so yep. So I'm not asking to be fussy. I'm asking just to help me clarify it for my thinking. So please know that, okay? So for certified assessors, we have MnCAT step 1, 2, and 3, and they are in instructions. Where to take them and what course numbers and secret links for step 3. Are we talking about specifically then support planning? Because like I said, all that sits in instructions.
Right,
on
right.
this training page. So
I
I'm sorry.
understand.
Like I said,
Yeah,
I'm
no,
just
I
trying
understand
to
that.
make sure I understand you.
You know, I'm just thinking when, somebody goes into TrainLink specifically, rather than in these training documents here that you're showing on the screen, but going into signing into TrainLink, having that all in one place.
Yep. I get it.
Rather than, find it on your training document site that you're showing on the screen, and then clicking on that, then having to log in and then get back to it. Rather, just go into TrainLink. This is the course that I'm doing in order to get certified, and it just
Yep. I hear you.
follows the
So
modules.
we could do that with step 1 and 2. I can't with step 3. And the reason not is because TrainLink in some ways is also a public site. There are other people that can be taking it. Step 3 is very specific to certification, and only lead agencies can certify certified assessors. So those remain secret links that only mentors can provide staff to ensure that someone else doesn't certify when they shouldn't be, and then represents themselves as a certified assessor. So this is a security issue, which is why it's not connected. I could make it so you could opt to go from step 1 to 2, but I can't do step 2 to 3, and that's why. So it's not trying to be difficult, it's trying to protect certification and the responsibility of lead agencies to ensure the person is a candidate and should be certified and is monitoring and supervising and employing them. Does that make sense? So like I said, I'm not trying to be argumentative, I'm just trying to help you understand the why.
Certainly, but even if the steps 1 and 2 could be linked, that would
Connected?
still be an improvement.
Yep, I will mark it down on discussion to speak with my e-learner next week.
Thank you so much.
Yep, you're welcome. Sorry, I didn't mean to be, just had to understand. Okay, we are at the hour, a little over, and I just need to say thank you to all of you. We have had I think, a very good and productive conversation today. I'm looking forward to the next launch webinar. I also will let you know that I will send out the PDF out to the whole mentor list. Even if some of you have already received it, you're going to see it again. Just know that the updated slides will show up later in the DSD archive training page. What else to tell you? And then I will also looking at, can we do a conversation that literally gives us a little more time in training and walks us through the current functionality document, like a quote unquote mini MMA, but that's for conversation with the MnCHOICES team this next Wednesday. And so once I have more information on that, I will get back to you. Please continue to put your feedback in on the MnCHOICES help desk form. It is much appreciated. And I really look forward to our conversation next month. It is useful and productive and timely to work with all of you. And we just know we appreciate this conversation as we support you to get ready for launch. So thank you, everyone, and we will see you next month.